So obviously, again, for well, our guests from outside of Chicago, I'm sure that you're aware that we've had a recent election. It did make, I think, the national news occasionally. And so we're all getting ready for a big sea change, the first time in 22 years. And so I would like to take the opportunity to ask our panelists what they would recommend that our new mayor, what advice they would give our new mayor in terms of integrating health and wellness into his education policy. So I'm going to ask our national speakers to speak first, and I suspect that our local folks have had that opportunity and they can decide if they want to share their thoughts publicly or not.
I'd like to pass on this question. I have to say that I think you have a wonderful new mayor. I think that you have a wonderful new opportunity. I think there are some different challenges here in Chicago. I have a hard time trying to speak about what happens here in the city. I do think that, let me take a step back. Part of the concern here is that the challenges that you're experiencing here in the city are not necessarily challenges that every city is experiencing. There are some common things and then some unique things. And the unique things are the things that are going to drive how you actually do things differently here. And so I have a difficult time really opining on that. But I think that there are some important models that I believe are already here in Chicago that can actually be built upon, that can actually be expanded upon. Not to give the mayor or his leadership specific recommendations, but I do believe that there are some things that can be done in a larger and more definitive way. So I'm going to stop there and pass it along to my other national colleagues.
Well, Shell, you don't mess around. Taking advantage. But I'm going to step out on a limb here. I had one of the you knew I would, right? I had one of the most amazing experiences about a week ago in the city of New Orleans, where the mayor invited several of the seasoned, wise leaders of the region to discuss their experiences of race, racism, and racial healing. And it was a diverse panel. The wife of Medgar Evers, the former governor of the state, his father, who had been the first mayor to bring people of color into his cabinet. And they talked about what it took to reach the level of love and understanding that they now have for each other, which they didn't have 50 years ago. You know, when they grew up in a climate that made them hate each other. And they talked about what it took to transcend that, to reach their humanity. And then the mayor bravely announced that this was the beginning of a comparable effort for the city of New Orleans. And I know all these other things have to happen, and they should continue to happen. But we as a country, and certainly Chicago as a city, we have to deal with the elephant that's always in the room. And we can do that, and we can be human beings who no longer carry the burden and the legacy of this ignorance. And so I would ask the mayor to be a participant in that work and bring that type of healing to the city of Chicago.
Well, I would hesitate to comment too much, only just because I think before you really have to have a thorough understanding of the context and the situation and the starting points before you start making recommendations. But one thing that I think you folks deserve incredible congratulations for is this new policy for inclusion of health goals in the school improvement plans. And I would really, I think that's very significant, very significant. Having said that, we all know that lots of policies get formulated, but the extent to which they really result in meaningful change is much more variable. So now that this policy exists on the books, I think the next step and the next challenge from the people in leadership positions is to help ensure that it's implemented in a serious way, a way that's based on data, where progress can be tracked, and in a way that involves local leaders from communities, elected officials, people in the school systems, and other people in communities. The other thing is, I mean, you're already doing a lot of things. You have school health teams at the school level. It seems like there's school health councils at the district levels. Again, those are great things. Nevertheless, no doubt there's a need for increasing awareness and interest among people in schools, among teachers and school administrators to increase their awareness about these issues and effective ways how to deal with them. And make no mistake, I'm sorry I didn't have more time. We really focused on the problem, but I can assure you that all of these problems we talked about have proven or very promising approaches to address them. So we know what to do to address them well. The other thing that I would like to see from the mayor's office is to keep this issue on the agenda. It's really, I think one of the issues that's said, and I don't know, it sounds like Chicago may be an exception, but the media hasn't really picked up on these issues, except perhaps when there's a big controversy and there's disagreement and drama. But the media really needs to play a vital role in educating the public about these issues and informing them. And then just lastly, I would echo just the same concern about breaking down the silos in the city government. And it seems like, you know, you have just the fact that you have your commissioners sitting right next to one another at the table is a great sign, and working together to come up with strategic solutions, coordinated solutions that make efficient use of resources by implementing high-quality programs.
I want to take just a different perspective on this. Mayor Daley is a great mayor for Chicago. During his tenure, Chicago moved from a Rust Belt city to one of the top 10 global cities. We can't forget that. As other cities in the Midwest were hollowing out, Chicago was developing its stature as the business service center of the world here. He's positioned us well to be the gateway for China in this next century. And all of that leads to a level of economic activity, prosperity, and vitality. At the same time, and think about his granular attention to every pothole, every issue in our community, and so understanding this community so thoroughly, and in spite of that, we still have problems, we still have unresolved grievances at this day and age. I want us just to be careful that as much as I know our mayor-elect is relishing the opportunity to demonstrate strong, bold leadership, that we don't end up encumbering him with all of our hopes and dreams and ourselves abdicate responsibility for what we need to continue to do. The world, in a sense, will be no different May 15th from May 16th, and we cannot stop doing what we've been doing, such as the work of the Healthy Schools campaign, has to keep going forward. We have that obligation.
I think from my perspective, when we are thinking about public health issues, it's really important to do kind of four things. It's really important that we identify what our public health priorities are, be very, very clear on what these priorities are. The next step is to really identify targets of where we want to be on these public health priorities. So it's really important that we are clear on the priorities, clear on the target. But then the third step is really make those targets public, and so that the public can hold us as a Department of Public Health accountable for what we say we're going to do. And the last step would be really to engage the community to help us achieve those targets. There are so many great community partners in Chicago that we really need to be engaged with and work with, whether it's city government or community foundations or research or federal government, that we really need to engage these communities to help us achieve those targets. So setting the priorities, setting targets for each one of these priorities, make those targets public so that we are held accountable for them, and really engaging the community to help us advance that agenda would be something that I would be interested in.
Well, thank you all very much. Just one last round of applause for our wonderful speakers today.